You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering liposuction. My first guest is an expert on the topic, board-certified plastic surgeon, Dr. LaGrasso. Dr. LaGrasso, welcome to the program.
Thank you for having me, Randy.
So what's changed in the last 10 years with liposuction?
There's been significant changes in liposuction, probably the most changes of any of the plastic surgical procedures. There's been a variety of new technologies that have emerged on the market. New ones are coming out, all the time. Everything is based upon the traditional approach of, where we're injecting a saline solution. And we're pretty much, the basis of liposuction is that you're removing fat from an area using a cannula.
Okay.
And, over the last 10 years, we've seen significant changes. There's been lasers that have been introduced to attempt to melt the fat and to theoretically tighten the skin. There's been ultrasound-assisted technologies, kind of like what we use, the Vaser,
okay.
Which uses an ultrasound probe to melt the fat. And people have been doing that. First, they've been trying it externally, and now we'd actually do it internally. And there's radio frequency waves that have also been used to attempt to melt the fat. The whole theory behind it is that, we're trying to come up with better ways to get the result with a better patient satisfaction and a faster downtime, get you back to work faster than the traditional ways of liposuction.
Okay, now we talked off camera, and even my perception is that everybody's doing liposuction the same way. Is that a frustration of yours? You think that's common, a common thought, that liposuction is liposuction?
Liposuction is definitely not liposuction.
Really?
I mean, first of all, there's a lot of different subspecialties doing liposuction. You have plastic surgeons doing liposuction. You have, internal medicine doctors. You have dermatologists. Everyone's got different training and different philosophies. I got to be honest, liposuction is probably one of the most difficult operations in plastic surgery.
Is that right?
To me, it's the second most difficult operation behind rhinoplasty.
So nose surgery,
yeah,
nasal surgery.
Nose surgery is by far the most difficult.
Why is this so tough, liposuction? I mean, it seems very straightforward. Respectfully, I say.
It seems like it. The theory behind it is you remove fat from an area, but the body's not a flat surface. It's not that easy. People want you to create a certain look and a certain image. Your goal in doing the procedure is to create a curve. So think about it. You're using something to remove the fat from the body to create a shape, but if you do that incorrectly, it could be a disastrous result.
Okay. Now I talked to the other. One of the other plastic surgeons that work with your company, and he says, Randy, we have these almost like secret protocols for great results, like a certain way you approach liposuction. Elaborate on that.
Yeah, we developed
it's called Smooth Sculpt. Is that it?
Exactly. It's called Smooth Sculpt. It's kind of Sleek's proprietary protocol. We kind of developed it. One thing Sleek has is that we all have board-certified plastic surgeons in all of the locations.
All right.
So you're only going to be treated by someone who's got the proper credentials, nobody else. And, one of the foundations of Sleek is that they want to bring to you the most advanced care. So we got together and we thought, what's the best way that we can get the best result for the patients? And this is what we came up with.
Which is?
Smooth Sculpt.
All right.
And, what it is, it's a combination of several different factors. It's a preoperative, operative, and postoperative protocol. The first thing that we do is we kind of want to get the fat ready to be removed. So we use an external ultrasound device, which kind of loosens up the fat.
So this is the day of the surgery?
This is the day of the surgery. This is about, depending on what areas you're doing, and every patient's a little bit different, between 15 and 30 minutes prior to the procedure, you're going to get the preoperative portion of the Smooth Sculpt.
Okay.
And what we're doing is we're actually taking an external ultrasound, we're putting it all over the areas to be treated, we're warming up the tissues, which is loosening up the fat, and it's kind of helping get the fat ready to be dissolved a little bit faster.
Okay.
And then afterwards, we do the operation. Now, what we're doing in the operation, we're using the Vaser, which is an ultrasound-assisted probe.
So this is with a small instrument, cannula.
Very small instrument.
Goes in there, and it's doing what?
We're making 2 to 3 millimeter incisions. They're tiny. They're about this big. They're inconspicuous once they're healed. We actually insert underneath the skin, through all the fat, this ultrasound device, and it shoots out ultrasound waves.
So it's like heat? Is it hot?
It does get warm. You
Okay.
can feel it, when you have your hand on the skin, the skin does get warm, but it's actually emulsifying the fat so that when you remove it, it's like putting melted butter on popcorn.
Really? Not an overstatement.
You can see the difference in the cannulas that we remove.
Okay.
When you do traditional liposuction, it comes out in little clumps. This, it comes out nice, smooth, just like melted butter.